you talk about that I love, and I think it can be challenging maybe for some women, but you do talk about sort of, I think you put it like, you know, show up to the party, you'll probably have a good time. And so this idea that if perhaps you give yourself the chance to get started in a sexually intimate moment, that you may actually just have a good time. And so it's sort of like the practice of use it or you lose it. And I think, and correct me if I'm wrong, I think you're talking about vaginal health as much as you're talking about desire. Is that fair?
I mean, there's mixed data on have sex so that you can keep having sex. There's some data to say, yeah, the vagina actually benefits by being stretched and by producing lubrication, and like your muscles don't get tight. And certainly I'll see, just because my job's to look at vulvas all day long, I'll see very, very tight, narrow vaginas that I'm like, if you were to just jump back into being sexually active, that might be very uncomfortable for you. Okay. So I think there's something to that, but I think where people get in trouble is when women feel like they should, right? Like, I never want a woman to feel like she should be sexually active, but it's like, the more you exercise, the easier it is for your body to exercise, right? And the other thing, especially with desire, is understanding dopamine and understanding long-term relationships. And I think so many couples, men and women, couples in general, don't understand that dopamine goes away after about 6 to 18 months of a long-term relationship. Now we're in a 15-year relationship.
Okay, right? that's a let's tap the brakes right there. That's a big deal. Is that right? I didn't know that.
So the Esther Perel is the big kind of couples therapist who's famous on that. She wrote a book called Mating in Captivity. And she says it's this paradox, right? Or it's the price we pay for monogamy, is that spontaneity, that desire, that curiosity, that like, what's it gonna be on Friday? Is he gonna want me? All that stuff is gone. Like, what how many holes are in his underwear? You know what you're gonna have for, he eats oatmeal every day for breakfast. Right. Like, that curiosity is gone, and you have to then cultivate, now that you're in this, where all of our brain, and it's neuroscience, right? Like, our brain pays attention to novel things. What do you do when it's not novel anymore? You have to create it. Or, I always joke, good. I'm like, you could just keep having new relationships every 2 years.
I mean,
you could. That's like where tons of spontaneous sexual desire happens, right? But a lot of people choose not to. Right. And it doesn't mean you're broken. It just means our brain says, yeah, I know what he's gonna do. I know how it's gonna go. I know that I might not. And then you have to challenge that and be like, let's try something new. Let's do it anyways, because I know I like it. I'm just not novelty curious about it.
Yeah, right. I think a lot of women, well, I should say several women I've spoken to, sort of get a little caught in a spot in this conversation that's about giving it a go anyway. There's this sort of like wrestling match that happens between, well, screw that. I don't want to do that. I want to like have a good time, and I want to feel good, and I want to do it, versus it becomes complicated. Like, am I doing this for him? Am I doing this for my partner? And all of that. And I think that's like a big part of what's happening also.
100%. And I always want to be very careful with that. You're right. Because I never want people to be like, she just told me to have sex anyways. I'm like, that can come across super ew.
Yes.
But time and time again, I talk to women that they're like, I really actually love sex when I'm doing it. I love it. It's a great time. I just forget how important and how much I love it. And I'm like, that's perfectly fine. That's the way our brains work, right? Our brains like, there needs to be food on the table. The bills need to be paid. I got to show up on time for my job.
Yes.
You're not remembering how wonderful sex is all the time.
Yes.
Like, that's okay. That's just our brain.
Yes. Yeah. And to circle back to these other things that kind of need to be squared up for, at least I think most women, to even get to the point where we're like, yeah, let's do this anyway. Or I can be talked into this, like body image stuff and sleep and stress, all of that matters. I think, I don't know, would you say more to women?
Yeah, 100%. I mean, they've done data on it, and they're like, the two big predictors of women who stop being sexually active is how the relationship's going.
Yeah.
and then, you know, any sort of like dryness and pain. So it's not that like libido just goes away, but you have to
Right.
actually like work on it. You have to work on your relationship. And I think if a woman came in and she's like, I would like to spontaneously desire heteronormative penis and vagina sex where he has an orgasm and I don't, I'm like, you can't, I can't make anybody desire that. All right. Like that's melted ice cream.
Yes.
So it's like working on the event to make it pleasurable. Like this is for women to understand sex is for them.
Yes.
Right?
Yes. This is why I'm Dr. Casperson. Okay.